Hi everybody, Tim White, clinical specialist with the Aspen After Surgery Center. We are here with our patient Michelle. Michelle is just finishing up her treatment today. Michelle is a fast track patient who came from out of town and was a part of our 5-day treatment protocol for her condition, which was implant capsular contracture. Anybody who's seen our videos before knows in detail, contracture is essentially a scar shell or a capsule that begins to tighten and thicken around the implant. And Michelle, unfortunately, had come down with contracture. Michelle, if you don't mind, tell everybody watching kind of like your case story of your surgery, what happened after that.
Well, I had my surgery in September, so about 4 months ago, 4 or 5 months ago. My surgery went well. I had no problems. Went home, recovered well. I went to my follow-ups. My doctor said everything's looking good. He actually used the word textbook.
Oh.
After a while, I just noticed that my left breast just wasn't healing the same as the right. It seemed to be rising up, in my opinion. It seemed a little harder, a little bit disfiguring, and that became a concern.
Was it lower and rose up, or did it always stay high since the surgery?
It stayed high.
Stayed high.
Yeah.
So we see two scenarios with patients where when encapsulation occurs, depending on the time frame, you can get capsular contracture 2 weeks after surgery. You can get capsular contracture 20 years after surgery. In cases where the implant after surgery, the good one drops and gets soft, but the encapsulated one stays high, that's normally a post-surgical issue, trigger, immune system, bacteria, or other, and you encapsulate early on, but it takes a while to figure out what's going on. That's our biggest thing that we see with patients is, I don't know what's going on. Is this normal? The doctor may or may not give you information, may say take a medication or go home and massage and you'll be okay. And the reality is it's the earliest stages of catching this, which is your case, which is why you've done so well, to know what it is and know that you have a non-surgical option like the Aspen treatment. Michelle gave us a call. She's a part of our fast track, so she came into town. We do a 5-day course of 2 treatments a day for 5 days straight. Today is Michelle's 5th day, and she did super awesome.
Yes.
So she's agreed to let other women know about her experience here with us. So, let's break this down. Let's make it scientific. So before you came in the treatment, the breast was firm. We just did your evaluation. I won't be the spoiler alert, but tell us how much softer your breast is in just the 5 days that we treated you.
I would say it's about 75 to 80%.
Fantastic.
And I still have a treatment left today.
Yeah, so she's technically 1 treatment short of the full, but to be able to get, a 75% improvement in 5 days straight, this competes with other methodologies like surgically revising the capsule, which unfortunately has a 70% failure rate because surgically correcting, even with the best surgeon or the worst surgeons, it's really your immune system that dictates this, and that's why the surgical encapsulation rate is so high. And there's alternatives, there's medications, there's skin strips that they put inside the implant. Now, we've seen here clinically still patients are encapsulating with that. So we feel the Aspen treatment being non-surgical, safe, effective, there's no side effects to this. We have a 90% success rate for patients that qualify. So, tell patients out there who may be dealing with this or considering, tell them about your experience here with the treatment. What was it like? What did you do?
Well, I came in, drove straight from where I was living, came straight in, they got me in, I came into a room, laid on the treatment bed, and I got a machine, the Aspen treatment machine, placed on my left breast where the capsule was.
And if I can stop you right there. So the Aspen System machine is a sound wave generator that we're the developers of, very unique. It sometimes gets confused with traditional ultrasound or orthopedic or even machines that plastic surgeons have in their office. Technology is completely different. I tell patients this because they seek out the local chiropractor or massage therapist or therapy clinic or even their plastic surgeon who has multiple machines, very popular names for cellulite treatments and skin tightening, and those are, quote, ultrasound machines. those actually don't work. They're not designed like ours, which is specifically designed for contracture. I've heard some pretty difficult stories as well. Specifically, lots coming out of California. I don't know why California, of patients saying they received some sort of device and it actually made their contracture worse, and some of them actually got burnt.
Oh.
So again, if it's not an approved Aspen System Center or the Aspen name is on it, please be very careful about how you pursue this treatment. Any downside to the treatment? Pain, discomfort, negative or other?
Honestly, the only thing was the soreness. Followed after I have my treatment with the Aspen treatment, there is a series of massages, passive massages that are done. Yeah, it's a little tender, I'm not gonna lie, but that's
Nope.
okay. I know it's working, par for the course,
Yep.
and I have great results, so it's worth it.
Great. So the massages, depending on the severity of the capsule, is kind of like stretching out a shoulder that's frozen or a knee after surgery that builds up scar tissue. It doesn't like to be stretched. In your case, your capsule was a little feisty, so patients can experience a little bit of soreness with that, but that resolves after the massage. You're doing okay, nothing too bad.
Correct.
All right, very good. Michelle, thank you very much. We appreciate your time in helping other people, learn a little bit about the Aspen treatment. Anyone can reach us here. You can go to our main website at aspenaftersurgery.com. You can call our main line at 954-341-7875. Michelle, thank you
so
again.
much.
Okay, best of luck to you.
Thank you.
Great.